everyone, my name is Erica. I am a second semester nursing student in a graduate nursing program, and I will be graduating May 2021 with my MSN and RN. So today I'm going to talk to you guys about why I chose the MSN route, as well as the benefits of it and how I handle the difficult course load. I decided to get my master's in nursing because it's always been a personal goal of mine to advance my education. Ultimately, my end goal is to become a nurse practitioner. I want to develop the expertise and leadership in my area of specialty as a licensed healthcare provider. I want to practice at the expert level and give my patients the best possible care. I feel that our nation is in need of experienced practitioners who will focus on health maintenance and disease prevention. So to me, becoming an FNP is more about educating patients to take charge and feel empowered about their own health as well as their families. And I believe that the FNP world is so incredibly diverse, constantly expanding, and the opportunities are endless. So I felt that this was the best stepping stone for me to pursue a master's degree because it would get me one step closer to that goal. Having your master's as a nurse can provide a wide array of career opportunities. So you can become a clinical nurse specialist and specialize in a particular area, or take a leadership role as a nursing manager or director, or even become nursing educators. The list can go on. But many hospitals in California are pushing for magnet status, where a majority of the nurses that are applying must be BSN prepared. And in time, hospitals will start to push for nurses that have master's degrees or even doctorate degrees. And I feel that having your master's degree will help you develop a greater knowledge in the healthcare field. And nursing is the kind of profession that consists of lifelong learning. It is essential as healthcare continues to evolve and advance that nurses must provide high quality care through current evidence-based practices to impact patient outcomes. Time management. I believe that is key to nursing school, and that is key to being successful, especially in a grad school program where there are so many assignments, papers, quizzes, discussion boards, tests, literally everything, etc. I use my planner to stay on top of my work and utilize to-do lists, which help me prioritize my studying time as well as my assignments. So this semester I'm using more of a block studying type of method. I feel that it's best for me to alternate days of studying, where I take this chunk of school of my classes, study for this amount of hours, and then just alternate the next day. It just helps keep my mind fresh of the material. And I also recommend skimming the content that you learn the day of as soon as you get home. It's going to be very beneficial for you, and it'll just stick in your head a little bit longer. And also, one thing that I am trying new this semester is doing the objectives for my classes. So if your professor offers that, then I highly recommend, because that's where they'll take the content and put that onto the exam. And I feel that it's also important to utilize all the resources that we have, whether that may be online through YouTube videos, different websites, or even utilizing study groups and practicing NCLEX style questions. All will be highly beneficial for you to understand the content, because at the end of the day, this is important for us to be able to care for our patients effectively. And also, don't forget that self-care should be your #1 priority. With all the stress that comes with nursing school, I believe that it's so important to remember to take care of you first. Alright everyone, that's it for now. Thank you again to Elsevier for having me as their student ambassador, and also being their first ever master's nursing student. I'm very honored and very excited to represent. So I wish you all the best in your nursing journey. Happy studying, and talk to you guys soon.